I just got my patient, just got you some new water, Miss Hendricks. Okay. Ideally, guys, the water should last until the feet. That's the best way to do it. But for some reason, mine was just getting a little soapy today and a little cool, and I had to handle my business, okay? Because I didn't want my patient to suffer because for any reason. All right. So I have new water, but after I do her leg, foot, I have to get new water and a new cloth as well. So remember, I did one arm and hand. I did the other arm and hand, okay? And then I did her chest area, abdomen, and umbilicus. Make sure I did that well. Now I'm at the farthest leg. I already have her covered. I can still use my same cloth because it's still good. Now, if it was extra soiled, we would get a new one, okay? Miss Hendricks, you want to test this water? Now remember, if your patient's water is, if your patient can't test their own water, then you have to test it for them. All right, Miss Hendricks, let me see what we have here. See my little drape is already there. So we won't want to see any sneak peeks, like I like to call them. I'm going to tuck right here. And I'm going to separate your legs just a little bit. And I'm going to tuck right here, okay? That way. Now in the hospital, you're going all high as you can, but we include a lot of this upper thigh portion in the pericare. On your demo here, you go up high here, but we don't want to see any of the personal areas on the on your peers, and you don't want to see them on your instructors either. So in the hospital, you're going all the way up. Remember, all that's included with pericare. Can't leave the inner thigh, the outer thigh, any of that up. Out, I should say. All right, Miss Hendricks, I'm gonna wash your leg, and I'm gonna just take this and pull it back for now. I'm gonna wash from ankle to thigh, and she's raising her leg for me. You have to decide whether you're doing that or they're doing it. And I'm washing distal to proximal. Again, promoting venous return, making sure I get under the umbilical, I'm at the knee, popliteal region. Going all the way up here. I'm gonna fold back this way, and actually I'm gonna take mine down here a little bit and go up this way, okay? Remember, you have to get under as well. Now I'm gonna rinse. Rest her leg. Now, if I had her leg like this, I could just do it like that with one towel, okay? And wash it like that and cover it. But I chose to use 2 towels because these are a little smaller. That's your choice with your towel placement when you're bathing. Depends on the size of the towel and the size of the leg. How you do that. Now I'm gonna, that was washed. I'm gonna rinse and dry her. Always your 3 steps: wash, rinse, and dry. And make sure you provide privacy, safety, comfort, communication. Safety and cleanliness being the number 1. Ms. Hendricks, do you feel like I'm rinsing you okay?
Mm-hmm.
All right, do you feel dry? I'm getting there with your leg. I'm not there yet. I'll have to pick it up. You have to be careful how you handle people's legs and things. If they're flaccid, make sure you handle it so it doesn't hurt the patient. You feel dry?
Mm-hmm.
Okay, now we're going leg, foot, okay? Because we think feet are dirty. They are dirty a lot of times. It depends on the patients, of course, but most feet, you know, we all wear flip-flops here in the South and things, and a lot of people don't have manicured nails and things, so we just want to make sure you don't take any bacteria there. So I'm doing the same thing here. Are you okay, Ms. Hendricks?
I'm good.
So I'm going to show you this method on this leg. This towel is small enough, and Miss Hendricks is small enough for me to do this on her leg here. Just got to get it right, thank you. So I can do that. That's the 1 towel method here per leg. And this one, I just want to keep out of my way, okay? Out of my way for now if I'm not using it. I don't know where I want it, but keep it out of my way. We like to see the soap on the skin, not too much, but not too little either. So you're really going to have to make sure you manage that soap on the patient's skin. Okay, that was a wash, and make sure I get a rinse, a good rinse. Again, we don't want any sneak peeks when we're checking you off. That's what I mean. No, if you see something gapping, close it. Am I rinsing you well enough, Miss Hendricks?
Mm-hmm.
Looks good. You might better check with your patient every now and then, because sometimes the soap with your gloves, you can be, if they communicate with you. If not, you might have to check their skin without your gloves on just to make sure. But normally we want you to wash the patient with your gloves. If there was a needle in the bed or something, it would be a line that fits for you. All right, now we're gonna wash your feet. We actually don't want you to go to the bottom of the bed to wash your feet. And actually I need to up her bed a little bit because I can start to feel it a little bit here. Because remember I lowered her bed to work for me? So now I'm doing her feet. Now we're not asking you to put their feet in the basins. You're gonna wash their feet. You can put their foot in the basin. I'm gonna choose not to today. I'm just gonna wash her feet really well. But after I wash her feet, I have to change my water, rinse my basin, get a new cloth, and I can only use that one towel on her feet. So what I'm gonna do now is choose to use this as a foot towel and this is the other towel, and I'm gonna just put it right here. Okay? So now, see how I'm gonna drape this. It's not rocket science here, but we just wanna keep things covered and warm. Thank you, Miss Hendricks. I think you're about to get your weight bearing capacity back.
Might be.
It's like you're doing pretty good with your movement.
Physical therapy.
Good. All right, so now I'm gonna wash her feet. Remember I've already done her legs. I'm gonna inspect those feet, and feet are a big deal with pressure ulcers and things. I'm gonna wash between her toes, making sure I check. And you know, I didn't tell you guys, but you can always check your capillary refill. Remember, it has to be less than 3 seconds, fingers and toes. You can check that. If you're out and you're open, you're cold there if you're not covered. So that was with soap, so now I gotta rinse her. Most of your patients are gonna be older and they get cold a lot easier. Going between her toes. And now I have to dry her. Now remember, if it's dark and damp, it grows bacteria, so that's between our toes as well. All right, is that okay, Miss Hendricks?
Mm-hmm.
Next foot. All right, next foot, same way. Just washing her foot. Between her toes real good, and I'm gonna rinse and dry just like prior. And I'm gonna dry. Remember, if they ever, you can't wet a dressing or anything, or take a dressing off just to wash their foot. You have to make sure you don't soak the dressing and things like that. Okay, now our feet are complete. Now at this point, I'm going to leave that towel here, take this, and I'm gonna get rid of that. I want to do both feet and legs to show you the exact order of that so you don't get confused, because you want feet to be last. This is going in my soiled linen, okay? Oh my gosh, look, my side rail. So if I did that or you did that in checkoff, that would be your one side railing warning, one side rail warning. So at this point, you'd have to go back immediately and put it up, okay? You get one railing warning in your bath. After that, the second time you leave your railing down, your bath is stopped, okay? So I'm okay, that's my warning, okay? So this is my dirty pile. I'm gonna come back here and now I know I have to dump my water. Miss Hendricks, I have to get you some new water for your bag. So just know, watch your railings. When you leave it, you put it up. Remember I said work your railings, but I want you to see, even walking away that far is a railing warning.